Welcome to the recorded version of Senior Cognitive Issues, part of the Family Caregiver Support webinar series, brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Our presenter today is going to be Dr. Amy Dupree. Dr. Dupree is a gerontological social worker and an internationally renowned expert on lifestyle issues relating to caregiving, retirement, aging, and family dynamics. Dr. Amy is president of Essential Conversations, Inc. and Dr. Amy, Inc., a company dedicated to family caregiver wellness. Dr. Dupree holds a PhD and master's in social work, specializing in gerontology, and she earned her CSA, a designation for which she also trains others as part of their accreditation. Dr. Dupree is a much sought-after speaker at corporate and professional events on the topics of caregiving, aging, and retirement, and she's also a frequent guest on radio and TV. And with that, I would like to welcome our presenter today, Dr. Amy Dupree. Welcome.
Thanks, Steve. I'm glad to be here, and I'm particularly excited about today's webinar because this is a topic that impacts so many people, as we know, and this webinar is really chock full of very practical tips that you can pass on to clients, ways for them to think about how to better manage difficult situations, and I think just ways to deal with things that we know are just very hard situations for family caregivers to be having to manage on a day-to-day basis. You know, what I'm really talking about is how families can better care for their loved ones who've been diagnosed with Alzheimer's disease or other dementias. According to Alzheimer's Disease International, in 2010, there were, as you see on your screen, 35.6 million people in the world living with dementia. I find that just such an overwhelming number when we see that. But, you know, it's not really about that or about the increase that we're expecting in the rise to 65.7 million by 2030. What it's really about are the individuals. It's about the families. It's not about this grand number. It's about the person who's living with your client or your client, if it's your client who has dementia. And how do we help create better quality of life for those people with dementia and for their families? We know that dementia is a syndrome that can be caused by a number of progressive disorders that affect memory, thinking, behavior, and the ability to perform everyday tasks. As you know, there's lots of kinds of dementia, the most common of which is Alzheimer's disease. So today I'll often refer to Alzheimer's disease, but truly the things that we're talking about are things that are effective for people with other dementias as well. My mother had dementia from a stroke and multi-infarct dementia, and she exhibited a lot of very similar behaviors as someone with Alzheimer's disease. Some of them were different, but I know that the ways that I was most effective in creating better quality of life for her and helping my father, whom she was living with, have quality of life was in using these techniques that really came out of a lot of the work done around Alzheimer's disease. We know that Alzheimer's disease causes the brain to shrink dramatically. And it's actually a brain change that is what causes all those changes in functioning and likely the changes in personality and relationships as well. We now have some great medications that can help slow the progression of Alzheimer's disease, but as you know, there's no cure. But there are ways more and more that we are finding that families can better manage this. And really, it's been so gratifying to me in the nearly 30 years now I've worked in this profession to see how differently we manage dementia now than we did 30 years ago. I, early on in my career, spent some time working at a geriatric assessment clinic. And a lot of times what we offered families was very minimal because we didn't have a lot to offer them. And now we know so much more. And we know that the research that's coming out tells us that those who are suffering with Alzheimer's or other dementias really do better if we keep them engaged through physical, mental, and social activities. And by doing that, we really can help create positive experiences for them and improve their quality of life and improve the quality of life of the whole family. So let's take a look at specifically what we're going to talk about during this webinar. We're going to begin by talking about how, by gathering stories and information from a loved one's past, family caregivers can help this person really make sense of the present and have more quality of life in the present. The Home Instead Senior Care Network calls this approach capturing life's journey. So we're going to talk about what does it really mean to capture life's journey. And then we're going to talk about how that information can be used to really better cope with behavioral and safety issues that are often very, very common for someone who has dementia. And I'm going to share with you some ways that you can convey this to families that I think is very simple and logical and will help them in a very, very practical way deal with those often troubling situations. And then we're going to end by talking about self-care of the caregiver. How can we help the family caregiver really have better quality of life as they're helping someone they love dearly have better quality of life? Let's start by talking about capturing life's journey, because this is going to be a big part of what we discuss today. So you see here on the screen, it's about gathering memories, assessing what you already know, asking questions, recording stories. I'm sure you're aware that people with Alzheimer's disease or other dementia often cannot remember what's happening currently, but they're still pretty connected for a long period of time to the past. And the problems that they have currently with memory and thinking and behavior and the ability to perform everyday tasks can be impacted by who they've been throughout their life. And the beauty of talking to families about capturing life's journey is that it gives the family a very tangible way to gather memories so that they can then assist the person in the current time period. So because they're no longer often able to store new information efficiently, knowing about the past of someone with dementia can really help them make sense of the present. Now, the families that you're working with likely already know many of their loved ones' memories. But something that I have found in working with families is that they become very focused often on the current picture they're seeing in front of them of the person with dementia. And as much as they will look at the current behavior through a filter of the person's whole life, they often forget many of the key parts of this person that they could pull forward to be helpful now. And that's why talking to them about doing this in a more systematic way can really, really be helpful. So what you can do is you can suggest that they start by writing down a lot of these memories, either chronologically or by topic. So, for example, you can have them think about who this person has been in relation to their family. And you can even go back to their childhood. It's a great place to go back to. What was their childhood like? What was their adolescence like? Their early, perhaps, marriage, if they were married as a young adult and raising kids. And write down some of the key events that occurred. Write down some of the key aspects of the person's life, thinking even about the pets that they've had, family traditions. And then, of course, other big topics include things like careers, leisure activities. Even thinking about the person's favorite foods throughout their life is a really key exercise because it's something that can often help in the current situation. Did they engage in sports? Was that something that perhaps they were a golfer for much of their life, or they loved being outside and being out in nature? One of the stories that I love of someone who used this very well was about a woman who had grown up on a farm, and she had spent much of her life actually living on a farm and managing the farm along with her husband. And later in life, when she had dementia and she was not living on a farm, she went through a period of time as the dementia progressed where she became quite difficult. And one of the things that her daughter found was that her mom just started refusing getting out of bed. And she couldn't figure out how to get her mother out of bed. She'd go to get her up in the morning, and her mother would pull the covers over her head and just want to lie in bed all day. And the daughter had done this exercise. She had gone through and she had written down all of these memories. And she sat down one day and she was looking through this, just trying to look for something to trigger for her to help her mom. And she thought about the farm life. And one of the aspects of the farm life was that her mom got up every day and did chores. And so the daughter knew that this had been very much for decades part of her mother's routine. So the next day she went in and just said to her mom, you know, it's time to get up, Mom, and it's time to do the chores. And that was the trick. Her mother got out of bed because doing chores was such an important memory for her that she knew that meant the need to get out of bed. that's the kind of way that families often don't think about using memories unless they have captured them in some sort of very concrete way like this. So one of the things that they can do in gathering their loved one's stories is observe the surrounding, ask other people questions. They can ask the person with dementia to start telling them about their life because, again, especially in early and beginning mid-stages, people still can remember those things from earlier in their life. Tell me about what it was like when you were raising children. You know, anything open-ended, we may just need to cue them. Now, the other beauty of doing this is that if they capture these stories in this manner, it's a great way to engage the person with dementia in conversation and activity by doing this. Also suggest to them that as they gather it, they might want to think about organizing it into a journal. It can be a binder, a notebook, a scrapbook, something that they have available to use and share. And then suggest that they separate the material into several categories, as we said, something like youth, marriage, career, so that they can easily access it and also add more information. Once they have the information, then they can start referring back to it when they have behavioral issues, when they're trying to engage the person that they're caring for, anything to make their lives less stressful and to make the life of the person they're caring for richer and more meaningful. Okay, so that's the basis of this, capturing life's journey. Now what I want to talk to you about is about the importance of keeping loved ones engaged and how we can work with families to better help them do this. What we know from research is that when caregivers keep their aging parents with dementia engaged through physical, mental, and social activities, it creates positive experiences that diminish the distress and also keep away some of the unwanted behaviors. You know, I'm sure all of us on the line who have had the opportunity to work with someone with dementia know that a lot of times the difficult behaviors really surface when the person is not engaged in an activity, is not getting enough exercise, is not being stimulated enough. And in those moments is often when we see a lot of the anxiety rise to the surface, a lot of the depression rise to the surface, and a lot of the agitated behaviors. One of the things that many times I've found that families don't realize is that the activities that they do with their family member who has dementia don't have to be something special. It doesn't have to be a big outing. As a matter of fact, a lot of times it's better if it's not because it can be overstimulating. Instead, getting them to engage in simple tasks like folding the laundry together or cleaning the house, those are activities. Now, obviously, this means it can take longer to fold the laundry and it can take longer to clean the house because you're also doing this with someone who has dementia. But I think it's getting the family to have a different mindset about this now. It's not how fast can I get the house clean or how fast can I get the laundry folded and put away. It's this is what's helping to keep the person that you love engaged in life. Cooking, especially, you know, if it's safe, the person can still manage knives and being around a hot stove. If they've historically done some of that, can be also another wonderful way to keep the person engaged. Again, this is where going back to the journal and thinking about what have they always loved to do throughout their life can be a real cue here to what they might still love doing. It also can really make doing activities of daily living much easier. So, for example, one of the things that people can think about doing is turning the bath time into an opportunity to do things like smell different soaps or talk about fashion or favorite colors when getting dressed. You know, again, this is a different mindset. This isn't racing through tasks, but by engaging the person with dementia in a different way in these tasks, it often makes the task easier and it becomes an activity. So I think that's the message we really want to help families with is see everyday tasks as activities when possible. Now, I say this within the context of understanding busy families, but oftentimes if they're rushing through a task, what happens is, as we all know, the person bucks the task, they become resistant, and then it becomes harder to get through the task, and then you have an agitated individual on your hand, and then you're trying to engage them in something else. So again, seeing it this way can mean parents who are happier and less stressed, and caregivers who are happier and less stressed. Obviously, someone with dementia may not have the same physical stamina, and they likely can't concentrate or stay focused for very long. So the key in all these things is flexibility and creativity. But it can be such a wonderful opportunity to have very special moments in very simple ways. I really did find that with my mother, that the pace of life slowed down significantly because of her dementia, and the way we connected was very different, and it was often very simple. But those are the memories that I have that also are the most profound about those times and just her smiling as we were doing something very simple together. Engaging someone who is in late-stage Alzheimer's disease can be a lot more challenging, as we know. They're not as present and often are not as able to engage. So one of the things we can recommend to families is to have them focus on the 5 senses, the touch, hearing, smell, tasting, and sight. So there may be something that provides a comforting touch, or they may have different textures now that feel comforting to them. I recently read about a facility that allows the people with late-stage dementia, they encourage them to hold stuffed animals and things that feel very soft to them, not as a way to infantilize them, but as a comfort. And that some of the residents who have exhibited very difficult behaviors have actually calmed down a lot when allowed to hold a woman. This is, again, a capturing life's journey sort of story. The woman had raised a number of children and had a lot of babies, and they got her a doll, and she immediately calmed down when she was allowed to rock the doll. So I think, again, looking at those things in late stages that, to us, we may not think about right away, can help families in realizing that they can still provide a lot of comfort at that point. Again, another way they can do that is about listening to music. We know there's a lot of correlation now between having music that is soothing and that the person loves from their past can still reach people with fairly late-stage dementia in a way that perhaps we can't reach them in other ways. We know looking at artwork is doing that. There are a number of programs now throughout the country that are being held at museums with bringing people with dementia to the museums so that they're able to just experience that in a very sensory way again. Looking at pictures, photos from the past often will do that for people. The goal, of course, is keeping people engaged and stimulated and lifting their spirits. And then we talk about earlier stages, not just the late stages. It's still letting them have a sense of accomplishment in what they're doing and a sense of connection and enjoying a positive relationship between them and their family members. So those are some very practical ideas about helping to keep people engaged. Let's now talk about how can we help people in managing specific behavioral problems, because as you know, this is often a big deal, is trying to manage the behavioral issues. So the behavioral issues that often come up, we know, are things such as refusing to do things, having delusions, becoming aggressive, a lot of false accusations. Certainly in the beginning, we know people often feel they're being stolen from, wandering, agitation, repetition. And caregivers are often shocked by these behaviors when they first start. They don't know how to manage them. And one of the common things that they try to do is to talk the person that they love out of this behavior. What do you mean? Don't you understand? That doesn't make any sense. Look around. You're already home. One of the big problems we know and why we talk about managing these behaviors is it often puts someone physically at risk, but it also puts their emotional well-being at risk. They're often not very happy if they're experiencing a lot of those aggressive, angry behaviors. So it puts them just in a place where they're not having a lot of calm and joy in their life. It can become dangerous physically, obviously, if it leads to refusing to eat or refusing medications or getting into physical altercations. So we can help caregivers by talking to them about the 4 things that you see on your screen. And I'm going to just talk about each of these briefly. But giving simple choices, apologizing, redirecting attention, and removing distractions. So let's talk about how they can do each of these. First of all, giving simple choices. This really allows the person with dementia to calm down and feel in control. This is, again, where having information from the loved one's journal can be helpful. So, for example, if someone doesn't want to get out of bed in the morning, a caregiver can, take a look and think, okay, wait a minute, I know they've got a couple of favorite breakfasts. Maybe I can get them up based on these favorite breakfasts and cook that as a motivator. So thinking about, would you like this or would you like this? And again, the key here, of course, is simple and not overwhelming people with choices. But oftentimes this makes a big, big difference for the person with dementia because their immediate response may be to say no to things. I know I saw this a lot with my mother with her dementia and a lot around eating. If you ask my mother, are you hungry? She'd say no. And I'd say, you should, my father often did this a lot. You don't want anything to eat? No. But if I just said to her, would you like to have this, Mom, or this? She would usually choose between the two of them. And that no response often becomes strong with people with dementia, and we can really help caregivers avoid that this way. So that's the first tip, simple choices. The second is apologizing or taking the blame for the situation. This really takes the attention off of the person, and it might help calm them down. Now, this may be apologizing or taking the blame for things that you haven't done, but we know that often will, again, have the benefit of calming the person down. It's not about being right at this stage. It's about creating an atmosphere of harmony. The person is no longer thinking clearly. This is a hard one often for families, this taking the blame or apologizing, because they think it seems to be just something that happens that we assume if we say it just right, the person will get it. And they look so normal. How can they not understand, that what we're saying is actually right? So I think this is getting families to just step back and take a new perspective in how they manage this. The third thing that they can do is to redirect their attention. Now, this, again, is another good place to use information from the journal. For example, oftentimes we know that people will start saying, I'm going to leave. I'm going to get out, I'm going home, right? It's time for me to leave now. I want to get home. And so redirecting them into an activity that they love and enjoy can really help. For example, I know one caregiver told me a story that her husband, who had dementia, had loved to golf. And she went out and got one of these little home putting things. And so when her husband would get agitated, she'd say, let's go putt some golf balls. And she'd go in the living room with him, and he would get engaged in putting golf balls, sometimes for quite a while. Because, again, favorite activity. So creativity in that way, I thought that was very creative of her. He could no longer go to the golf course, but he could putt balls in the living room. A favorite TV show is on in a few minutes, and that's where people are able to record TV shows and use those as an opportunity to calm someone down. Sometimes that will work. Let's go get a snack if you know that that's something that might motivate the person. So anything that redirects in a very calm way can be helpful. So, in this case, teaching families to say, I understand you want to go home. How about if before you leave, we just spend a few minutes having a little snack together? And as we know, once you change people's direction, they usually forget about what's going on and they forget the agitation. Or let's go do something, let's go over here. How about if I take you over here to this golf place that's here, and it could just be in the living room. The fourth option is to physically remove items that are causing distress, or to remove the person from the environment if that's bothering them. And this is especially key. I hate to say this in the middle of September. We're only 3.5 months away from the holidays right now, actually 3.5 months away from Christmas. But if you look at Thanksgiving, just a couple months away. And oftentimes caregivers will try to put a lot into the holidays and will take the person with dementia a lot of places or have a lot of people over, and it's too much stimulation. So knowing if there perhaps can be a quiet place that you can go off to with the person so they can not be agitated and overstimulated. Removing them from whatever is overstimulating them is a great way to go. And then, of course, the other way to do it is to remove whatever the item is that's bothering them. And it could be a picture that's triggering them, or it could be even something as simple as a person who they're no longer able to connect with that you just know they can't spend time with. So removing themselves or the person from the environment is really key. The other thing that you can share with caregivers that is very, very effective is to try 3 times, 3 different ways in order to change a situation. That's what they need to do. It may not work once. So after teaching them these 4 things, say to them, it really can take 3 times, 3 different ways in order to change a situation. But in the end, if you do that, you're helping to create a better quality of life. So it's worth making that effort. So that's some of the things on managing behaviors that can be really successful that we can share with our clients. Let's now talk about how do we help them keep their loved ones safe, because this is very key. So identifying and preventing is obviously one of the first things we want to do is prevent, but common mistakes, troubling behavior, and physical challenges. Let's talk about how we can teach families to do this, again, in a way that's memorable and easy. I think sometimes what happens for people who are caregiving for someone with dementia is they get overwhelmed by the quantity of information that gets sent their way, and they just need a few practical things that they can try and see if those work, and then try something else. Obviously, someone who has dementia is becoming increasingly unable to take care of themselves. So being aware of the dangers they face and taking preventive action can really reduce the likelihood of accidents and injuries. In the beginning, we know that common mistakes that we're talking about are things such as misunderstanding the mail or forgetting to pay bills. You know, that's often how families, we know, start to recognize something's wrong. The environment isn't what it used to be. The person can't manage it, and they start doing things improperly. Then it can become a little bit more serious. Certainly things like forgetting how to turn the stove off or getting confused in the best way to cook. So when I was very, very young, I had I worked as a caregiver when I was in college, and I had a woman who had dementia that I worked with, and I was doing overnights with her, and if I didn't get up before her, she would get up in the morning and often boil orange juice on the stove because she'd forgotten you don't cook orange juice. She just remembered that you turn the stove on and you boil something. And so she would often leave the stove on or do things. And what was interesting was her nieces, who were her caregivers, did not realize how bad her aunt was until I was staying there because her aunt did such a good job of covering it up. And that was clearly a safety problem in the making. And we know that's what happens in families. They often don't know until things become pretty significant. So, for example, not remembering how to drive the car or how to get somewhere. And then, of course, it can be starting an oven fire or drinking something toxic or forgetting to take medication. So we also know that troubling behaviors often come up. So those are common mistakes, but in the troubling behaviors, it can be getting into altercations. You know, people become aggressive and they start becoming often combative with people who may not understand what their issue is. They may also hoard or hide important things or want to leave or look for something or run from a caregiver. And then in the physical challenges, we know there's an increased risk of falling or spilling things or not being able to respond to alarms that, a fire alarm's going off and they don't know what to do. So when you think about how can families help with these 3 areas, the Home Instead Senior Care Network recommends using what they call the PREVENT system. So let's talk about what each of these letters stands for. So in the PREVENT system, the P is about protecting this person from financial and health neglect by helping them sort mail and making sure they take medication. So again, those are 2 examples of how to protect them from the neglecting. R, the R in PREVENT, is about removing clutter and removing items that can cause harm. This could be space heaters, for example, or loose rugs. Wires might be, at some point, removing the coffee maker from sight because they're trying to make coffee and they forget to put water in, and they're turning it on and leaving it on, leaving the carafe on there. All of those kind of things are the things about removing. E is for the environment, looking at the environment. Perhaps they need to modify the environment for this person by installing door locks or child-proof electrical plugs and latches, automatic shutoffs, removing knobs from appliances. All of those type of things are environmental changes we need to encourage families to think about. And, of course, we have to remind them that these things shift over time. So it's following the person through the different stages of dementia and making sure they do that. V, the V in prevent, is for visually inspecting everything to make sure there are no new dangers present. So that really goes along with the E. It's about being aware of the environment a lot. And then the E, again, and the second E in prevent, is about encouraging loved ones to use handrails or other safety devices to prevent falls. It's about encouraging them to hold the grab bars in the shower. So it's that constant reminder, because we know that the encouraging has to go on a continual basis given the person can no longer remember these things. The N is for navigating the person's symptoms and being aware and flexible to meet the new challenges. And that's so important. Again, it's constantly changing. That's the thing, which what makes it so stressful often for family members, as we know, is it's not a stable situation. You deal with one issue today, and 2 weeks from now, you may have a whole new issue that you have to deal with. And then the T is about talking to their loved ones, to the doctors, to other caregivers, perhaps family members who are engaged, professional caregivers, about any concerns, and about asking everyone to be sharing those. This can really go as far as saving someone's life. If there's concerns about how medications are being taken, especially in the beginning, oftentimes it may be a professional caregiver who sees that first, who's aware of that. There's numerous stories I know about people who are mixing up their medications, and family didn't realize this because the person was still able to function fairly well on their own. And then when a caregiver was brought into the home, suddenly they found out there were a lot more issues going on, sort of like what I described with that woman who was boiling the orange juice, and that medications weren't being taken, and there were real safety concerns. And I think that's why getting everyone involved in this as a team and thinking about the talking is so key. So teaching families prevent can really help them in better coping with these situations. Okay, so we're talking about the person with dementia. What I want to do now is switch gears and talk for just a few minutes about the caregivers and how can the caregivers take better care of themselves. And we're talking now about the family caregivers. So I don't have to tell you about the demands of caring for a family member with Alzheimer's disease. If you're on this call and you're a person who is caring for someone with Alzheimer's disease, you know this. And any of us who've worked with families who are coping with this, we know how challenging it is. And oftentimes what happens is caregivers, over time especially, begin to focus all their energy on their loved one's care. In fact, we know from research that many people really start neglecting their own care when they're caring for others. And that's a dangerous thing because we know that people who do that often are experiencing great physical and emotional stress. They may not be sleeping well. They may have headaches and muscle aches, stomach problems, hair loss, weight fluctuations. And we know it often leads to anxiety, depression, irritability, mood swings. Let's face it, if you're experiencing that stuff, how well can you really take care of someone else? So I think we really need to focus a lot of attention on getting caregivers to take better care of themselves. And I know what a challenge it is to do that when you're caring for someone who has dementia. So there are the three things you see on the screen can be great ways for caregivers to think about this. We can encourage them to think about how well they're doing in these three areas: their own self-care, staying connected, and relaxation techniques. Now, this is separate from, of course, getting additional help, making sure that they're not the only caregiver. We've talked about those on other of these webinars, and we will be talking about those again. And those are also really key in taking care of yourself, is making sure you're not doing this solo. But for today, we're going to focus just on these three things. So let's start with the self-care. Clearly, this means sleep, exercise, eating well, drinking enough fluids, getting checkups, making sure they're getting their preventive tests. Now, I understand that these things become very challenging when someone is caregiving because they are focusing so much attention on someone else. And sometimes I've suggested to people that they use a very simple checklist to just see how they're doing on these things. Are they getting enough sleep most nights? If the person is wandering a great deal during the night and they're not getting sleep, that's a problem that they need to manage for two reasons. Where the wandering itself can be dangerous and is often a sign of agitation, but the caregiver is losing sleep. So we have to look at these things from both standpoints, the person with dementia and the caregiver. So in the self-care, I'll say to people, just do a checklist for yourself. See how you're doing. You getting enough sleep? And if they say, no, because of this, well, that's what you need then to focus on, is how do we make sure you get enough sleep? It's not acceptable to say you can go without sleep for long periods of time. And if you've been on other webinars I've done, you may have heard me say this, but I will talk to families now because they get this. Would you ever expect your cell phone to work endlessly without recharging it? And the answer is no. You've got to recharge your batteries, and sleep is part of recharging your batteries. So preventive things, making sure they're getting to their own doctor's appointments. And oftentimes, especially spousal caregivers, will do these things when we explain to them that if they don't do them, they're not going to be able to continue caring for their loved one. That often is more motivating than taking care of themselves. And my father, when he was caring for my mom, stopped smoking at the age of 77 or 78. And later, when we talked about it, and I said, why did you do it? And he told me he was having this symptom for the last year of smoking where he found his heart rate sped up, and it scared him. And he said, I wanted to make sure that I was here for your mother. And so what motivated him more than his own health was being there for my mom. And professionally, I've heard that story over and over again. So I think we can access families in various ways to get them to do the right thing for themselves. If they won't do that for themselves, we can access it that way. So the self-care key. The second part, staying connected. We know that people who have good social support do better. They live longer. They live healthier mentally and physically. They're less apt to end up in nursing homes themselves. They heal quicker from illnesses. And the latest research on social support shows that it has a protective factor against Alzheimer's disease. And there's more and more evidence, again, that good social support impacts us well cognitively. So encouraging caregivers to have a strong social support network is very, very key. And we want to make sure that they build in some time for those relationships that nurture them. Even if it's just a cup of coffee with a friend, a quick call to a loved one, maintaining their spiritual or religious practices. And again, we know that often the objection to this is, I don't have time. And so by explaining the importance of this and helping them figure out, how do you carve out time for that? Just a little bit of time. Could be an hour a week that you go have coffee with somebody. That can make all the difference. Picking up the phone, getting on a chat room for caregivers late at night, if that's the only time you have, and feeling that sense of connection can really help. Okay, so that's the second technique. The third technique that you see there are relaxation techniques. And we know that these really work to help counter stress in our lives. The simple practice of breathing deeply a few times a day reduces people's anxiety. Obviously, meditation, yoga are excellent ways to reduce the feelings of stress related to caregiving. We need to encourage caregivers to do something that will help them. I often, when people say, I don't have time, say, could you set an alarm for every hour? And again, this is where smartphones can be very helpful for this, that you set an alarm every hour and you literally just stop for 30 seconds and deep breathe. People have told me that that alone has helped change how they feel. So I think encouraging simple practices, I think one of the things, again, that I have found frustrating professionally is how often people are told to do these things without really ever being told how to incorporate them into their very busy lives. And so just saying, go take a yoga class rarely works if people are feeling too busy. But if we can give them very specific ways to start building it in and they feel the benefit, that's when we see that they're able to do this. Okay, so those are the combination of good self-care, staying connected with others, and employing relaxation techniques can go a long way to help caregivers go the distance with less stress and more enjoyment. And we know the other benefit of that is that they're likely to be more patient with the person they're providing care with and be able to provide better care. Let's now talk about a couple of resources that you may find helpful. There's a resource that's not here that I send you to in case you haven't had a chance to get on this website. It's called helpforalzheimersfamilies.com. And it's all of that written out, helpforalzheimersfamilies.com. On there, you're going to find a wealth of resources. But one of the resources that's really key on there is now video training available for family caregivers about all of the topics we talked about today. So about capturing the life's journey, about managing behaviors, about keeping the person engaged, about safety, and there's one about better understanding the whole disease process of Alzheimer's so that the person who's caring for them better understands why these changes are happening. These videos are short. Some of them are 3 minutes and some of them are 15. They're no longer than that. They're very short, very practical. They can be watched at any time. They're free, which is really key. So great for family caregivers. Also on that site are lots of wonderful resources. And David Troxel, who is a fabulous expert in this field, has a question and answer column on there, and he has wonderful tips that he's offering. And David helped develop a lot of these resources. So I really encourage you to get on that yourself and take a look around so you can send families to it and to encourage families to get on there. Also, caregiverstress.com has wonderful resources for families of someone with Alzheimer's disease. And then, of course, the Alzheimer's Association is a phenomenal resource. And I always encourage families to get on and to go to their zip code and, figure out what's going on in their communities so that they can access the local as well as the national resources on that. Okay, before we go to questions and answers, let's take a look at next steps. So as we finish this up with this information, I just encourage you to think about what resources you can recommend to families, the families that you're working with, to help them better understand the issues of caring for someone with Alzheimer's or another dementia. We've gone over a lot of resources today, and then, of course, what specific strategies can you share with the caregivers? So I encourage you to explore some of the resources and then to share these very specific, applicable strategies with the family caregivers so that we can make their journey easier and can make the life of the person with dementia richer and more meaningful. And, of course, the self-care tips. What can you share with family caregivers to help them in that way as well? So thinking about all of this, I'm going to turn the line back to Steve, and Mary Alexander is going to join me, and we're going to take your questions now.
Great. Thanks a lot, Amy, and welcome, Mary Alexander, as well.
Thank you. Thanks for having me today.
Absolutely.
Okay, first question, do you have any advice for adult children and spouses on how to convince another person not yet diagnosed with dementia to get to the doctor for medical evaluation if they refuse to go?
Well, the way that I always suggest to people, and Mary, I know you have a wonderful way that you talk about with this, so do you want to go first on this?
You bet. I think you have to take sometimes a different approach. This is a scary topic for people, especially as they age, and I think you need to look at it like taking a little bit of the fear out. We are all used to going to the doctor or to the dentist to get preventative care. And if you can go and take that approach, that we're just going to go for a checkup, you can make a call to the doctor prior to going saying, I have some concerns about my mother. Her cognitive ability is changing rapidly. She's not in a position where she wants to talk about it, but we're going to come in for a general check, and I'd like your opinion, and maybe start the conversation. This takes a longer period of time. I mean, you can't just say, Mom, I think you have cognitive issues, and we're going to go to the doctor. That has a lot of anxiety attached to it. So you do have to start the conversation and ease into it, and again, make it be part of your normal medical checkups that you do, and just kind of backdoor your concerns with the doctor.
Okay. Next question, Amy. You were talking earlier about making that space to care for yourself, and this next question kind of refers to that. Question is, what can we do for Alzheimer's patients who are determined to have capacity but aren't able to really care for themselves and refuse assistance? And the same scenario as a caregiver too. So, what do you do for people who, obviously are struggling but don't really want to seem to accept that help?
So not the caregiver, or the caregiver as well, but also the person with dementia. It's
yes.
Both ways? Okay.
Yeah,
okay.
Both scenarios.
It's a tough situation when the person who has dementia is not yet ready to accept that, and they're fighting it. There's no doubt about that. If there are safety issues involved, you have to deal with this. So I especially when there's safety issues, I really, really want to stress that. If it gets to a point where it's truly unsafe and the person is absolutely refusing help, you really need to call Adult Protective Services in your county. So I'm doubtful that the person's thinking of it being that extreme, but I just want to say that because I think if a person's losing capacity, we cannot allow them to become in a dangerous situation because they're not able to make those decisions well, right? So sometimes what you can do, and a lot of this depends on the personality and it depends on the stage the person's at. Sometimes having a doctor or someone that they trust who is not a family member sit down with them, so it can be a geriatric care manager, a doctor, a friend who is willing to sit down with you and have this conversation can make all the difference. Sometimes people are much less resistant to a professional or someone outside the family and saying, here's what our concern is, if they're at a stage that they're able to do that. Now, depending how far along they are, that may or may not work. The thing about caregivers who won't take the help, this is tricky too, and again, that technique can work well with caregivers. Here's our concern if you're not going to take this help, that here's what we know happens to caregivers. Again, sometimes people will do things because they're worried they won't be there to care for the person when they won't do it for themselves. So using that tact often does work. So as I talked about my dad and the smoking, being able to say to somebody, if you continue down this road and you don't do good self-care, here's what we know happens to people. And I know you want to be here to care, for your husband or for your wife. And so I'm really going to encourage you to think about how you can go the long run. And, I often use this analogy of the difference between running a marathon and a sprint and getting people to understand, you're running a marathon. When you run a marathon, it's a very different technique than when you run a sprint. And you're still acting like you're running a sprint and you're a long way into this. And, that's when people collapse and fall over. So we want to help you go the distance. And that's my goal. And I think getting to why the person won't accept help is really key here too. Is it that they're not accepting help because they think that only they can do it well? Is it a money issue? What is the issue? And if you can address that, that is often the way to go. And I'm sure Mary has something to add to this.
I do. I'm going to add a little bit of a personal story. I recently was a caregiver for my dad, and I'm in the business of aging, and so I struggled with all of the tips and tools and resources that were out there. As a matter of fact, I narrate so many of the caregiver stress videos, and so I should know how to do this. But what I failed to see, and Dr. Amy helped me with this, she gave me permission to say that I couldn't do it. I waited for someone to tell me, you need this. And I think I was just waiting for someone to give me permission to say, it's okay. You don't have to handle this on your own. You can get help. There's a number of different ways you can get help, from your church to social service organizations, to home care companies like Home Instead, to just your next door neighbor. And so I think sometimes we fail to see something so obvious, and it's just give someone else permission not to handle it on their own.
Okay, great. Next question is about showers. What do you suggest in this situation? We have some aides who have a difficult time getting a client into the shower. Do you have any tips?
I think both Dr. Amy and I are going to answer this question. We have some great stories about just hygiene in general when you're dealing with someone with a cognitive issue, and sometimes it's the approach. I think you have to think about it from the beginning of setting up the shower and getting someone ready. You can't just walk into someone's room and say, time to take a shower, let's go, and move them off and do it quickly, which everyone has a lot to do on their plate. And when aides are trying to get this done, they have to give maybe 10 showers that day. So they're on a time crunch. But you really have to start setting up this discussion with someone slowly. The other thing is, too, Dr. Amy talked a lot about pulling something from their memory. So a great story that I know that we've shared before in webinars is we had a retired colonel as one of our clients, and he absolutely would not bathe. He wouldn't do it. And so as we were talking about and looking at his life journal, and we saw his extensive military background, we decided to try an approach where we said, all right, Colonel, your inspection is in 1 hour. We have to be dressed and ready and in line. And sure enough, he snapped right to attention, got in the shower. We were able to bathe him and put new, clean clothes on him, and he was ready for inspection. But by the time that was all done, he had forgotten why we were doing it. But we were able to get the job done, and we were able to bring him to a safe place as to why that made sense for him. And I think we have to look at making someone do something that they're just not sure they want to do, and taking the time necessary to give them to adjust to it, and then also use some of their history as to why they need to do it. Dr. Amy?
I think it was beautifully said. I don't think I need to add anything to that.
Okay, next question. What do we do in a situation where the child of a patient, this patient is directing a lot of anger at this child and not at any other caregivers, verbal as well as physically abusive? What do we do in a situation like this?
Where one person is sort of the target is what we're talking about here.
Yes.
That's not uncommon. I actually saw this with my mother. There are 5 of us in my family, and for whatever reason, after my mother had the stroke, one of my sisters became sort of the target of her anger and aggression, and it was hard, on my sister, obviously, but as a family, we were able to talk about that. And I think sometimes just being able to talk to the person that we don't always know why this happens, that someone becomes like that, becomes the target. But there were just things in that case where we did not have my sister do them because it would agitate my mother, or if she got agitated. One time my sister was trying to put my mother to bed and she refused, and my mother was in a wheelchair and she clung to the wheelchair for dear life. And at the time I was out of town working on my doctorate, and my sister had to call me, and I had to talk my mother, through it before my mother would get out of the wheelchair and get into bed. So it does happen. I think reassuring the person that it doesn't mean that they don't, it's not about whether the person loves them or loved them, and then figuring out ways to cope around this. If that again may not be the person to do certain things if they're the ones that are agitating them. Mary, do you want to add to that?
Yeah, what I would agree. I think the part is that especially when you have a sibling situation and one of the siblings agitates the parents, sometimes you need to remove that person to a certain extent. They still need to be a part of their parent's life and share in the responsibility, but it doesn't do anybody any good to upset the parent with a cognitive issue. It doesn't do any good to upset the the child with it, and they can do other things. They can run the errands, they can make appointments, they can help in other ways. And there is no rhyme or reason to why someone just chooses that behavior to someone. And I think that that's really important. It's a feeling. At some point it just becomes a feeling that they have, and that's okay. I mean, I think you have to just realize this is part of that process, and it happens to some people.
Okay, can you talk a little bit about individuals who are in the earlier stages of dementia? How do you best support someone in that situation, and are there any good assessments to identify someone who might be in an earlier stage?
Well, one of the things I think is really key is to make sure that you get a very thorough assessment. And I always say it's good to start with a family doctor, but likely they're going to need to run, they're going to need to be tests run and things done to do a really thorough assessment. So it shouldn't end with a family doctor. One of the things I think is so key is 75% of the symptoms of dementia and depression are shared. So oftentimes people get misdiagnosed even in something that simple, and you want to make sure that everything's been ruled out and that the diagnosis is accurate. So I really want to encourage that. And the place to start may be your family doctor. There also may be a geriatric assessment clinic or center nearby, and those are really key places to get a good assessment. And then a lot of what we talked about today are wonderful techniques that work great for people in early stage because they're still able to engage so much. So they're able to be very active by using life's journey, capturing all those life journey things they used to love to do. There are ways for them to continue to do it.
Okay, you were talking earlier about, redirecting approaches, things like that. And this next question kind of applies to that. It's a situation with a very strong man who's in later stage Alzheimer's. He's walking on the furniture, lifting and moving the furniture all over the place, rearranging the furniture, not throwing it, but just rearranging it. Do you have any suggestions on how they might address this situation?
I think we could both give you some tips, but I think you need to go back to, the presentation. And when we talk about redirecting, it's critically important for whoever's caring for him to know some things in his past, some things that were important to him. It could be what his job was. I mean, with not having any context around why he's moving furniture, did he work in a warehouse? Was he a furniture mover? We have to figure out some things in his past, and then we can redirect the behavior. We can tell him that the truck is loaded and we don't have any more to move. Everything else stays, and then have him go do something else. Can you help me with this? Redirect is such a powerful tool. Some people think that if they try one thing and it doesn't work, you have to keep trying with the redirect approach, because it may take 4 or 5 ways to get him to come around. But again, knowing some things in his background, his job, his history, his childhood, 2 or 3 or 4 really key pieces, that's when you can start using the redirect technique, and it tends to work better.
Great advice, and I love the part, Mary, I was sitting here as you were talking, thinking was, I wanted to remind people that try 3 different things 3 different times, and so I love that you said sometimes it takes 4 and 5 times to find the redirect that works. It's not a magic pill, where it works every time. It may work this time, then you have to do something the next time to redirect that's completely different.
Absolutely right.
All right. Well, we are just about out of time for today's web seminar, but I want to thank our presenters, Dr. Amy Dupree and Mary Alexander from Home Instead. Thank you again for another wonderful presentation.
Absolutely my pleasure. Thank you.
Thank you. Have a great day.